Hey Instagram, it's Dr. Rick, and today's unboxing is going to be on Thyroid Energy by Now Foods. And it's called Energy because it seems to boost up energy, but I'll tell you why. Although there's B12 in here, I think it's because your average person doesn't have a steady flow of iodine in the diet, or selenium or zinc. And there was a World Health Organization bulletin several decades ago saying that iodine is fine in the United States. Used to be in the goiter belt, which is the Midwest. There was a lot of people with thyroids getting huge, and used to see that in the Philippines. But since we have been able to get that identified and put iodine in mostly breads, even Morton's salt contained iodine. But what have we done? We've also put in gluten into breads, and we've also put a big label on if you have high blood pressure, you shouldn't be taking salt. So I think it's falling out of favor, and I think there's a lot of blossoming that I'm seeing in the clinic. The thyroid is this bow tie looking gland right here in front of your Adam's apple, and it's not supposed to have these cysts in it. The thyroid is a very well-functioning gland. If you eat properly, if you get good sleep, if you don't have too many stressors and or diseases, it should function until you're 80 to 90. As things age, the glands don't keep up, just like ovaries and testicles. But you'll know that, and sometimes it's necessary to test it. My average colleague will do something called a TSH, thyroid stimulating hormone. And that's a hormone that comes from the brain to tell the thyroid, please make more, or don't make too much. And it's supposed to be something called a supersensitive test. In my experience, I've had normal looking TSHs and then abnormal looking blood tests and ultrasounds. And usually if I do an ultrasound because of an antibody that I found being positive, that's called Hashimoto's, usually those ultrasounds will show goiters. And it's not life-threatening, but sometimes as those goiters expand in size, it might be the beginning of a cancerous change. Do we have to get all these tests for everybody? No. But if you're having symptoms, and the symptoms of underactive thyroid are usually oily skin, hair loss, weight gain, constipation, depression. And then the symptoms of your hyperthyroidism, when it's acting too much, would be also a little bit of hair loss, problems with rash, problems with anxiety, problems with diarrhea, problems with palpitations, and excessive weight loss. That might sound nice, but it's not really, because all those other symptoms all come together. So if you have the hyper side or the hypo side, it might be worth it to get the TSH, and most of my colleagues usually do. But whether you follow the parameters of an average TSH level or get extra stuff, I think I would investigate further. So here's the problem. TSH, that's the one blood test, the assay has a wide range of normal. In many circles, especially the endocrinologist, they'll accept you going up to 4.99. It can go, most labs will go from 0.5 to 5. And unless you break the barrier and go to 4.99, 5.1, then you're underactive. An underactive thyroid usually equates to an elevated TSH. An overactive thyroid usually equates to a TSH that's low. It sounds opposite. You don't have to worry about those details. That'll be up to your doctor. But bottom line with this video is, if you do have the symptoms, you might want to ask. It's always okay to ask without being too pushy. Can you get more tests done? And if you get hit with no, it's not necessary, just take your medicine. There's always ways to reach me, www.herbal411.com. I'll put a link down below. Here's the label for the ingredients you'll find. Hopefully you can see that. I think that the most important ingredients would be the selenium, the iodine, and the zinc. There's other things in there as well. And why do you need all those things? The thyroid gland, after being given messages by the brain about make more or make less, it starts to produce thyroid hormone. T4 and T3 are the most popular and well-known thyroid hormones that come from the thyroid gland. But for this thing to work properly, it needs a complex of cofactors to create the hormones. Otherwise, it will make crappy hormone. A big portion of those complexes includes selenium and zinc, and a little bit of B12 and a couple other things. But if you don't have those, even if you take a ton of iodine, it won't be able to produce it properly. And if the thyroid does not produce the right amount of hormone, it starts to get nudged by the body. in theory, it can be overstimulated to make more product because the brain says, I need more, I need more. So it increases the TSH. And if the thyroid can't produce because it doesn't have the building blocks, but this is kelp, and I think a lot of people will say, oh, I need iodine, I'm a thyroid patient, I'll just take kelp. And I think it's fair, but the problem I find with taking iodine in supplement form or kelp form is you have to trust that the kelp has iodine in it, usually will because it comes from the sea. You have to trust that the kelp does not have radiation from Fukushima many years ago, but still something to be concerned about. If you are a thyroid patient, you might want to practice some regularity of ingestion. Outside of kelp and seaweed and sushi, if you have that every day, be careful because there's a lot of mercury in fish. The only way, as I mentioned before, to get the iodine in the past was to have it in the bread products and in the salt. So if you're thinking about using bread as your iodine supplement, there is a problem. And here's the problem. So I circled this thing, this says gluten. So bread products, pasta, that they do contain iodine, but they also have gluten in them, most cases. And if you are thyroid challenged, as I mentioned before, I would include thyroid antibodies as far as the robust testing. I considered a full panel. The problem would be if you have antibodies that come back positive, whether they're 30 to 1,000. If they come back positive, that means you're making antibodies to attack your own gland by mistake. That's called an autoimmune disease. And the autoimmune disease, which is usually termed as Hashimoto's thyroiditis, it can be temporary. It can be from not enough building blocks. It can be from something in the gut triggering antibody attack, and then the antibodies attack not only the gut, but every other organ and gland. When you feed these antibodies gluten, or if they sense gluten in your diet because you're doing too much thinking that you're taking iodine, you'll actually turn the antibodies on more. So it's important if you're thyroid antibody positive to probably get off gluten for about 4 months. It's a tough one, and you'll have to do a lot of research. It's too much to fit into this video. Until you've balanced things out, it's probably a wise idea to be good with your diet. Having the cook in the house that buys the food on Sunday and prepares for the whole week, it's important to do a little bit of reading. It's not that tough, but you have to have a list of things that you can and can't have, and you just stick to it. I'd say 4 months at the least to see the effects. And that brings me to people who are low on iodine, selenium, or zinc. If you're already taking thyroid hormone, which usually comes in the form of levothyroxine, synthroid, or tyrosine, and those are T4 derived hormones, then you have to be careful about taking in extra iodine, selenium, and zinc suddenly. I think that if you are on the verge of a thyroid problem, you have the symptoms of hypo or underactive, or you have the symptoms of hyper, overactive. If you haven't reached the point where the blood tests are abnormal, I think it's fair to consider taking thyroid energy. I don't think it will hurt. In fact, if you look at your average multivitamin, it already has, this is a multivitamin for men. It already has iodine in it and zinc and some bits of selenium. It's in multivitamins. It's in prenatal vitamins because at that point in time when the baby's being grown in utero, it's very important to have several things. In those cases where the body is really fine-tuned and growing, you need that stuff. So if you need it in pregnancy, you would think that if you're going through a disease process and you're also in a delicate balance, it would be helpful to have it. And the other medicines for thyroid are also Armor, Nature, WP, and NP. So the first three that I mentioned, T4. These down here are T3 and T4 in different balances. And there was recently a recall on Nature Thyroid and WP, so hopefully they fix what happened and they make their product standardized, which they do, but it was only 2 different doses that were taken off the market back in September. Bottom line is that these are all thyroid hormones. They're usually available by prescription and paid for by insurance. But as I was alluding to, if you take all this stuff and then suddenly you start taking what can be considered a massive dose of selenium, iodine, and zinc, you can turn on the thyroid. If you take a supplement that has thyroid in it because your thyroid isn't working that well, and then you turn on the thyroid, what's going to happen is you'll probably be hyperactive. And that's not good either. So it's always important to discuss this with your doctor because this is not meant to be a substitute for medical advice, but this is what I tell my patients. So it's a lot easier for me if I have somebody that's on the verge of me diagnosing a problem. TSH, free T3, free T4, reverse T3, and I've done a video on reverse T3 in the past. Antibodies to TPO and thyroglobulin, and then even an ultrasound is necessary. I think all those things serve as metrics to decide a direction. In addition to your symptoms, obviously. We always take all those things into consideration and we say, okay, you're about to develop it. Let's go ahead and pull the trigger because symptoms are getting worse. Well, before getting the medicine, it might be worth it to invest in a supplement. But the thing is, you don't just take a supplement as you feel is necessary. It's probably got to be something that you do until you fine-tune your diet. If the diet can be substituted and fine-tuned or at least personally designed to have all this stuff in it, that's cool. If you're just going to increase your diet and try to stick in a lot of bread, gluten, seaweed, and just supplements, it can be confusing. And remember, you've got to continue that for life, depending on where you live and your nutritional plan. It's important to, number one, eat healthy. Number two, identify if you have a problem by getting the right tests. Number three, if you're already on thyroid, get help before, or at least get the permission before starting to add a couple of these things. In my case, where I have people that come in and they sound like they're hypo or hyper, and I haven't given them a prescription yet, I would say, do this. I do it for about 3 months, and then repeat blood tests and see if we've made a difference in symptoms and blood testing, maybe ultrasound too. But that all depends on your copay or your deductible per year. So we don't want to have you spend too much money. But if you're not sure about which direction you're supposed to be going into and you want a full scope of, let's see where we are as a baseline, I'd get everything I just mentioned. So if you're already taking thyroid hormone and you're stable and you haven't changed the dose in a while, but your symptoms are starting to pop up, as long as nothing else is going on, I think it's fair to at least experiment and see what this does for you. Make sure everything else is okay, because if you have other diseases and or you take other medicines, it might interfere. If you already take a thyroid hormone, that is okay. Don't feel bad that you've given up. It might be that your disease process is too out of control, that you need the help of a hormone. But I would always say, you can still work on fixing your diet. You can still work on losing weight. You can still work on balancing life. But what I've seen is that some people don't even know how to take the thyroid hormone. That thyroid hormone is really sensitive. It binds with everything. It binds with food, definitely binds with calcium and magnesium, so you can't take anything with that thyroid hormone. There are some studies that say you don't take anything as far as a supplement for up to 6 hours. That would be Tums. So Tums is a stomach medicine for reflux and indigestion. Well, it binds like a magnet to the thyroid hormone. And if you take the thyroid hormone, I usually say keep a warm glass of water, that tiny little pill by your bedside. And as soon as you open your eyes in the morning, just pop it in and drink really quick and then do your business. And then maybe about a half hour to an hour later, then you can go eat. And then maybe a couple hours after that, you can take your pill. So you can see it's a big pain in the ass. So this is a study about selenium and if it helped with lowering thyroid antibodies. And it did. It was a meta-analysis that looked at people with antibody-positive thyroiditis, and they gave them selenium, and it showed that the people with selenium versus the people with just the thyroid medicine and placebo, the people with thyroid medicine and selenium actually lowered their antibody levels. So there is some help afforded by fixing those deficiencies that we normally have. If you do fix your deficiencies with something really good, then continue, fine-tune life, fine-tune your nutrition, exercise, lose the weight, and then maybe switch over to food. I don't mean just these things, but switch over to healthy food. Hopefully in the distant future, you'll be more tolerant to gluten. I think that if you've already experienced some form of autoimmune disease, you probably should keep gluten out of your life. And there's a lot of substitutes now. There's many different grocery stores that have gluten-free areas. You can even order when you go out to eat, if you ever go back out to eat again, gluten-free parts of the meal. So you just have to declare that to your server before they start cooking, because they have to use a special pan. They have to make sure the chef knows, and that way they don't feed you any hint of gluten so you have an allergic reaction. That's fair. The only problem is if you take iodoral, which is iodine, you can find it at most pharmacies, compounding especially. There have been some studies that show if you just take iodine and you don't take selenium or zinc or the other cofactors, you can actually worsen your antibody response. So that's why it's so difficult. If you take iodine by itself, selenium by itself, zinc by itself, cool. If you take iodine and then you eat Brazil nuts and or fish and dark leafy greens, there's no guarantee there. So I like that there's a fixed amount and you know you can take it, especially if we're trying to reverse disease. I'll leave you with this. If you already have disease, then it might be a very delicate topic and you have to stick your toe in the water first. But this is the reason I put this together, is that at least some people will be guided as far as which direction to go. Can you afford all these tests? It depends on your insurance. I think Quest does offer some discounts. Ultrasound, there are places, if you're one of my patients in Arlington Heights, Bright Imaging is cheaper than your average hospital. I would consider that if you're finding that your deductible is too high. You can always change around your medicines too, depending on your insurance. Armor is probably the most expensive desiccated thyroid hormone that you can get. And when Nature comes back on the market and WP opens up their different doses, you'll have a wide variety. Hopefully by this summer and next year, you'll be able to get all those things back again. When you take the T3 in combination, whether it's in these products or just the use of Cytomel, which is T3, T3 is the very active form of thyroid hormone. Most of the time, doctors just give T4 because it seems to be easier, as long as you can convert it to the active form. But what do you need to convert T4 to T3, which is the active form? Selenium, iodine, zinc. So if you're not taking that stuff, if you have restrictive dieting, again, get it checked out. You can do those things with regards to blood testing if your doctor will allow it. But bottom line is you're not alone. If you have questions, you can put them down below. If you have your preference to what kind of thyroid you use or what kind of supplement you use, please put them down below. I just found that the Thyroid Energy is probably the most robust and the most accurate. And now, again, just to let you know, it's on back order, but I've talked to the representatives from Fruitful Yield and Now Foods, and it's hopefully going to be produced again really quick and back on the shelves. But until then, just try to eat properly, take your medicines, make sure your doctor knows your symptoms, and hopefully the milieu of all those symptoms, whether hypo or hyper, will be able to calm down a bit and you'll be able to see a little bit of vision to a better life. The worst case scenario would be if your doctor is not willing to change anything, you'll have to honor that, because if you have an HMO, you have to stick with that doctor, but you might want to seek out a functional medicine provider in your area. I think that the functional medicine doctors, MDs and DOs, are well versed with handling different things that might be complicated. And some endocrinologists that specialize in thyroid disease will be open to using T4 and T3. Some of the older ones will just say, no, T4 has to be it. But in the end, you really have a choice. If you're limited because of insurance, pay out of pocket and go see a functional medicine provider. Sometimes even if you are not allowed to take any other medicines and you're stuck, if you see a naturopathic doctor, they can give you guidance on different food types, and or a nutritionist can really be there to coach you and design a sustainable nutrition practice for you. Hopefully this gives you a little bit of an idea. Don't forget to subscribe to me on my YouTube channel, hit the alert button to find out when I do new videos, and share this with somebody else who's having a problem with their thyroid. Stay healthy and thanks for watching.